Well, good afternoon, and thanks to all for joining us this afternoon. I hope everybody had a restful Labor Day weekend. Today, we'll provide some updates on our COVID numbers, some state programs intended to help Virginians, and elections planning. First, I want to look at our health numbers. We continue to see roughly 1,000 new cases a day statewide. Our percent positivity is at 6.8%, which has been decreasing for 12 days now, and that is good news. Previously, we had concerns about increased cases and positivity in the eastern part of Virginia, so we added some restrictions in Hampton Roads, as you know, and it looks as if that plan worked quite well. The average daily cases in the eastern region are going down, as you can see, and the percent positivity in the eastern region has been decreasing now for 17 days, now at 6.2%. And that's really good news. We're seeing a slight increase in hospital beds there occupied by COVID patients, but overall, we are very pleased with the region's progress, and last week, as you know, we lifted those additional restrictions. And I want to take this opportunity not only for the folks from Eastern Virginia, but also up in Northern Virginia. When we've had these outbreaks, the local elected officials and business community have really cooperated, and I can't thank all of you enough for that, and certainly for being part of the solution. We, however, continue to keep an eye on some other regions in Virginia. For example, Southwest Virginia is seeing more new cases per day on average, 229, than any other region in our state, even Northern Virginia, which is home to a lot more people living closer together. Since Southwest Virginia has fewer people and fewer hospitals with fewer ICU beds and capabilities, this continues to be concerning to us. The percent positivity in Southwest Virginia is 8.1%. This has been decreasing in recent days, as you can see, but is the highest in the state right now, although the central region is not far behind. I know that our local health departments and local officials are keeping an eye on these stats and looking at ways they can take action in their communities. I continue to remind everyone in Virginia to keep doing the things that we know work: physical distancing, avoiding large gatherings, and wearing face coverage in indoor settings. Ultimately, it is our behavior that will get this pandemic behind us. So despite what we are seeing at the national level on a daily basis, I appreciate all Virginians being responsible and being part of the solution. One of the ways that everyone can help is to download COVID-Wise. Last month, Virginia was the first state to launch a COVID notification app that uses Bluetooth low-energy technology. And I'm pleased to say that more than 500,000 people have downloaded the app. 515,824 downloads as of yesterday. We estimate that's around 12% of Virginians between ages 18 and 65. If you haven't downloaded the app, please do so. So that's great, and I'm grateful to all those Virginians who have downloaded the app. This tool has literally great potential to help us curb the spread of this virus, and I hope all Virginians with smartphones will use this, including our college campuses of our universities and colleges. So now I'd like to turn to some updates on our efforts to help people during this pandemic. We all know we have more people unemployed, more people who need assistance with rent, with food, and with their utility bills. Earlier this summer, the State Corporation Commission ordered a moratorium on utility disconnections early in the pandemic, and I really appreciate that. This has helped us protect public health and keep families safer at home. Now, that moratorium expires tomorrow, so I've asked the SCC to please extend the moratorium through October the 5th. This will give the General Assembly the time that they need to finalize the budget and address this very important issue. The budget I sent to the legislature includes a moratorium on utility disconnections, a repayment plan structure, and a debt forgiveness program. These are important steps to help families keep the lights on while facing economic hardship. I'm hopeful the SCC will agree to extend the moratorium. Now, let's turn to two of the key issues we've been focused on since this pandemic began: PPE and testing. We have also authorized $42 million in CARES Act funding for additional PPE distribution. This will provide critical PPE supplies to federally funded medical clinics, congregate care facilities, local health district offices, child care facilities across Virginia, and more. On testing, I'm glad to say the Virginia National Guard is continuing to help conduct COVID testing events. From April through July, our National Guard collected nearly 106,000 testing samples and helped distribute nearly 1.3 million pounds of food around our Commonwealth. They are a critical part of our pandemic response. And we will have more news soon about eligibility for the Small Business Grant Program, which is providing more than $70 million in grants for small businesses affected by the pandemic. We focus that program first on the businesses most in need, and now we'll expand eligibility to ensure we can help as many businesses as possible, and we'll have more about this next week. Now I'd like to talk for a moment about the upcoming election and the work our nonpartisan administrators are doing to make sure the voting process moves safely and securely. We all know this will be an unprecedented election. The combination of a presidential election year and a pandemic is something none of us have ever experienced. I want to make sure that you understand all of your options that you have for casting your ballot this fall. We expect a high number of absentee voters this year. That is the term for voting by mail or in person to Election Day. So far, prior to Election Day, so far, the Department of Elections has received 790,000 requests for absentee ballots by mail. They'll start sending out these ballots this Friday, the 18th of September. For comparison, 4 years ago, 566,000 total votes were cast absentee and only half by mail. So now, 7 weeks before Election Day, we have already surpassed absentee demands from 4 years ago. We know that that demand will continue to go up. This year, anyone can vote absentee. You don't have to provide a reason as you did in the past. It's important that for you to have all the information you need on all the ways that we can all vote. So let's kind of walk through that, if you will. Most importantly, you can vote absentee safely and securely. As I said this Friday, September the 18th, local registrars will start sending absentee ballots to Virginians who request one. Requesting an absentee ballot is easy. You call or visit the website of your general registrar for your county or city and ask them to send a ballot to your residence. You can also quickly request a ballot on the Department of Elections website. That's vote.elections.virginia.gov. One more time, vote.elections.virginia.gov. Once you receive your absentee ballot, complete it, sign it, and mail it back. Or you can hand deliver it to your registrar's office. This year, for the first time, thanks to legislation just passed by the General Assembly, you can use a drop-off location. Secure drop-off locations will be located at registrar's offices, all satellite voting locations, and at polling places on Election Day. It's just that easy. Drop-off locations will be listed on your local voter registrar's website. You can also call your registrar for a list. We have allocated money to ensure that all absentee ballots have prepaid postage, so you don't have to worry about a stamp. That's been taken care of for you. Now let's talk about the security. We have taken extra steps to ensure the security of our absentee ballots. Every absentee ballot envelope is required to have an intelligent mail barcode and an election mail insignia. This is a critical security tool. The insignia tells the Postal Service that this piece of mail is a ballot and should be prioritized. The barcode will let you as a voter track your ballot once it leaves the registrar's office. That way you know when it gets mailed to you, and you'll know when it gets delivered back to your registrar. If you prefer to vote in person, there are two options. The first is the early option. Starting this Friday, you can vote early in person at your local registrar's office. This lasts until October the 31st, one of the longest early voting periods of any state. The other is the traditional option. You can vote on Election Day. Polls will be open from 6 a.m. to 7 p.m. We're using CARES Act funding to make sure all of our election officers have PPE, and the Medical Reserve Corps will be volunteering at polling places to ensure social distancing and sanitization measures are followed. Here's what to expect about the results. It's important to know that Virginia law allows election officials to pre-process absentee ballots as they come in, which means we don't have to wait until election night to begin that process. It's not the same in other states. That said, everyone should be prepared to wait a few days to know the results of the presidential election as states count unprecedented numbers of mail-in votes. It's important to ensure that all votes are counted and for the process to work. It's better to get an accurate count than a fast one. I want Virginians to know your vote is safe and it will count. We consider election security to be a top priority, and in recent years we have taken measures to strengthen election integrity and promote voter confidence. And I want to remind everyone that the people serving as election officers and working in local voter registration offices are our friends and neighbors. We all share the priority of ensuring free and fair elections. While we're on the subject of counting things, I want to remind Virginians that the U.S. Census is still ongoing and encourage every person in Virginia who has not responded to the census to please do so. While response rates are high in some areas of the Commonwealth, they are low in others. We're launching an awareness campaign in these regions to remind everyone that the deadline is coming up, and it's really important to make sure that you are counted. And as I've said in the past, just keep this in mind: for every person that we don't count in Virginia, we lose $2,000 per year that we could be receiving from federal resources. $2,000 per person. You do the math, that adds up very quickly, and that's money and resources that we deserve and we should get back in Virginia. So please take time between now and, we think, the end of September, although that's been extended, but please go out there and make sure that you are filling out your census papers. September is Suicide Awareness Month, and last week was National Suicide Prevention Week. Every suicide is a tragedy and a difficult loss for loved ones. I want to particularly highlight the problem of veteran suicide. The U.S. Department of Veteran Affairs estimates that 17 veterans die by suicide a day. I'm going to repeat that. Every day, we lose 17 veterans to suicide in this country. The 2017 data from Virginia Department of Health shows that 231 veterans died by suicide right here in Virginia. This represents approximately 21% of total suicide deaths that year. One suicide, as I said, is one too many. Virginia now has more than 725,000 veterans. As a veteran and an Army doctor, I treated wounded soldiers. I saw firsthand the strength and courage of our men and women in uniform. It's not weakness to ask for help. If you or someone you know is having a difficult time or needs immediate help, please call this number, 1-800-273-8255. I'll repeat that, 1-800-273-8255. This is the number for both the military crisis line and our veterans crisis line. And finally, I want to again remind Virginians to get a flu shot. Flu season is coming on top of the pandemic, and a flu shot can help reduce the pressure on our hospitals and keep people healthier. I know we all have a lot of extra things to do these days, but this one is really important as well. So now I'll turn it over to Dr. Norm Oliver for a health update, and then we'll be glad to take your questions. Thank you. Dr. Oliver.
So just a quick update on the numbers regarding the COVID-19 pandemic. Today we report from 5 o'clock yesterday, total number of cases is 135,514 cases. That represents 943 new cases in that reporting period. Our deaths have increased to 2,839, and yesterday we reported 96 cases. If you look at our website, under a tab called Key Measures, you will find a graph that depicts cases that are reported by it's a graph of cases reported by the date that they're reported. Occasionally there will be a spike, as we have in this number, and that just represents catching up with death certificates, which come in much later than what we get from the hospitals, for example, and doesn't really reflect what's happening with the disease. If you look at a different graph, which is the deaths recorded by the date of death, you'll get a much better picture of the course of the disease. You'll see that we had a peak earlier in the year, and it's been leveled off and we're in the low teens for many, many weeks now. Testing has been going well, as the governor mentioned. We now have a total of 1,922,966 tests that have been conducted. The record from yesterday was 12,395 tests. We have the Guard and others who are in the process of carrying out community testing every day this week. We expect to continue to do a good job on these tests. Thank you.
Thanks, Dr. Oliver. Thank you, Governor. Be glad to take your questions.
Are you weighing additional restrictions for Southwest Virginia, like the ones that we saw on the Eastern Shore? And a second question about the elections. You said Virginians should be ready to wait a few days before knowing election results. Do you know how quickly in our state the state will be able to count absentee ballots?
Mel, thank you for the two questions. Let me answer the second one first. I think Virginia will be fairly quick compared to other states. As I tried to articulate, we can actually count our absentee ballots as they come in rather than waiting on the night of the election. Other states, and off the top of my head, I'd have to look at what other states have different policies, but I think, those are the ones that we're going to have to be a little bit more patient with, but we should have the results fairly quickly in Virginia. And, we've had a lot of elections in Virginia, and we've worked closely with our Board of Elections. Our Secretary of Administration, Kiana Connor, have really made this a priority. And I want to reassure Virginians that, first of all, it's important to vote. and second of all, that every vote will count, and we'll do it safely and securely in Virginia. Regarding the Southwest, as you saw, the positivity rate in the Southwest is 8.1. In the rest of Virginia now it's less than 7. So, and if you look at that graph, Mel, the last few days, and again, it's not a week-long or 2-week trend, but it's tending to trend down. So we're watching it very closely. You know, all options, as I've said from the beginning, are on the table. The most concerning thing about the Southwest, and I'll repeat this, is that we just don't have the hospitals and especially the ICU capabilities. And so, you know, I would ask everybody, not just in the Southwest, but throughout the Commonwealth, to continue to follow these guidelines, continue to keep that curve as flat as we can, and hopefully we won't have to make any changes. That certainly wouldn't be my intentions now to put further restrictions on the Southwest.
Whitney Evans, VPN.
Hi, Governor. Thanks for taking my question. So you mentioned the Southwest, and you said previously that you were sending people out there to find out more about why the numbers were so high. What have you been able to find? Is it that people aren't wearing masks or keeping their distance, or businesses not following the rules?
Yeah, I think it's kind of all of the above, to be straightforward about it. Obviously, we have seen, especially in some businesses, a lack of compliance. We are following that closely. We've also seen, and I really think, again, the communities and the colleges and universities have done a good job. As you know, we had an uptick in numbers in Radford when students came back on campus. We saw an uptick in Montgomery County, there in Blacksburg, and we've tried to be as nimble as we can and get in there with testing and tracing and education. And so I think there are a lot of factors that contribute to the numbers, but again, we'll continue to follow them. But I think being aware that it's a potential hot spot, and for people to do the right thing, especially in our college towns, which they are doing, will be important in keeping those numbers down.
Sort of a follow-up to Whitney's question. How has sort of the first month of the emergency temporary standards been? How many investigations, enforcements, fines have there been, if you can sort of give us an idea? And then one other question for COVID-wise. You mentioned the number of downloads. Does that also equate to the number of people who have opted in, because that is the next step? Can you say how many have opted in and how many times the app has been used to actually notify someone that someone has gotten a result, punched it in, and used it as intended?
Thanks for that question. Regarding COVID-wise, I can take that one up. As you know, we're very intentional in working with the vendor that constructed this app for us to protect people's privacy. So we don't track it. We don't know whether or not we know that it's been downloaded. We don't know whether you then opted in, because we're not tracking what you're doing. And we're not also tracking other aspects of your use of the app. So I don't have numbers on that. What we do know from studies that have been done recently at the University of Washington, conducted by researchers there and with colleagues from Oxford, is that they looked at use of exposure notification applications in the Seattle area, King County, and a couple other counties. And they found that even at low uptake of such an app, at 15%, that you could see 15% reduction in infections and an 11% reduction in deaths. So we're at 12%. We're going to keep going and get as many as we can. We know that it will be effective. I've heard some anecdotal stories, including from the founder and CEO of Madison in Maine, which is the marketing firm that is helping us with the advertising campaign around COVID-Wise. He downloaded COVID-Wise and got notified recently that he had possibly been exposed. Thankfully, when he went in for his test, he was negative. And there will probably be other stories like that that will be anecdotal, but I don't have hard data.
He asked about the enforcement across Virginia, too.
Do you want to speak to the enforcement? Yeah, you want to speak to the enforcement?
Hi, Megan Healy, Chief Workforce Advisor to the Governor. I can talk about the emergency temporary standards. Those are workplace standards at Department of Labor and Industry. The 6-month emergency standard started July 27th. There is a little bit of a ramp for businesses to be in compliance. They have to work on their infectious disease control and preparation plans, and Department of Labor and Industry is working really hard with businesses to make sure that they are compliant. There has been many complaints, and they take each complaint very seriously, and they've moved forward with some formal investigations, but those aren't public yet because they haven't been completed because these standards are fairly new.
Thanks, Megan. Elaine?
I have a couple of questions, but I'll do them.
Okay, let me get my
I'll do
pen
them
out, Kate.
one at a
One
time.
at a time, I appreciate that.
The first one is Maryland announced last week that it had completed its order of antigen tests through the
Yes.
Rockefeller Foundation. Can you give us a status update on Virginia's order and whether there's been thought to how those tests would be deployed?
Yes, thank you. Dan, I may let you address. I continue to talk weekly, sometimes more frequently, to our fellow governors. And just before Dan comes up, Dr. Carey, there are about 10 states in that compact now, and we're, as a general, we're working together and ready to communicate with the manufacturers and ready to purchase when they're available to us. Dan, if you want to elaborate on that.
Thank you, Governor. Yes, we are working very closely as part of Virginia's participation in the multi-state collaboration. We are doing our final stages of our analysis. The original purpose is, one, to make sure that Virginia and the other states band together and get the best prices for point-of-care antigen-type testing, but also because manufacturing hasn't risen to meet the demand, we're trying to give that clear signal to the marketplace to manufacture those. And Maryland did indeed put an order for 250,000 of one type of the test, the Becton-Dickinson test. We in Virginia are assessing and have assessed the types of point-of-care machines that are here. And we are, to answer the second point of your question, you asked how will we prioritize and where to send those tests. So our priorities remain the care of the most vulnerable. So we're looking at what the needs are of our assisted living facilities, our senior care centers, our federally qualified health centers, and our free clinics and the like, and other congregate settings to see where their testing supply needs are and how we might assist them further. So we're in the latter part of our analysis, and we're almost to the point, but have not yet put the recommendation to the governor to make that final step. But we are very much engaged on a multiple times per week with the Rockefeller Foundation and the multi-state collaborative.
Is really just about Virginia's numbers. And, you know, when you look at the COVID dashboard, we're seeing that new cases are on average around 1,000 new cases a day. Our percent positivity is actually 7% as of today. But when you look at neighboring states like Maryland and North Carolina, that positivity rate is, 5% or under. So, I mean, for you, are Virginia's numbers acceptable at this point?
Kate, I appreciate the question. And, I would make the point to Virginians, we want to be leaders. I want to be leaders. We want to be the best in everything. And so, yes, when I see neighboring states at 5 and we're at 6.5 or 7, that bothers me. But, as I mentioned earlier, Kate, we're doing, I think, all the right things with PPE, with testing, with tracing, but it's the behavior that's the challenge. And that's up to Virginians. And if we can, despite what's going on in Washington, and I'm not going to touch that anymore, but despite what's going on in Washington, if we can do what we know works, and that is wear facial protection, that's not too much to ask, and keep our social distancing, that's not a whole lot to ask, and wash our hands frequently, then we can get our numbers even lower than 5. And it's that behavior. It's that behavior that will put this pandemic behind us. Not testing, not tracing, not PPE, but behavior. And that's what we need to continue to emphasize to Virginians and to Americans, that it's the behavior that will get this health crisis behind us, and then we'll be able to move on, get our economy back up and running, get our children back in school, all of the things that we knew as normal prior to COVID-19.
Tracy Agnew with the Suffolk News Herald.
Thank you for taking our question. Will the state push the Virginia Department of Health or maybe the Department of Education to release site-specific data on COVID outbreaks at public and private K-12 schools like it's been doing for long-term care facilities?
I'm sure, Marissa, can he repeat his question? I didn't hear the...
Will we release the site-specific data for public and private education?
Will we release the
I think the numbers at the different schools.
outbreaks?
Yeah.
Up till now, I don't think we've had any that I know of. So as I understand the question is whether or not we will release the numbers regarding outbreaks of cases in K through 12 schools, both private and public. I think what I'll say on that is that we will certainly keep track of those outbreaks. I believe that we can provide aggregate information, and depending on the nature of those outbreaks, we may find the need to release information about specific outbreaks. But at this point, that's about all I can say on that.
I have time for about one more question, Laura.
Governor, I know you said you were maybe not going to touch what's going on in Washington, but I wondered if, as a doctor, you wanted to address what President Trump said about downplaying the risks of the of COVID early on.
Well, Laura, let me make a couple points, and I appreciate the question, but you know, I've said all along that we are fighting a biological war. Our first case in Virginia was on March 7th, believe it or not, a half a year ago. And we began fighting this war, and when I say we as the Commonwealth of Virginia, and also we as governors, without the supplies that we needed. And from the beginning, I think that the governors have really taken a responsible leadership position in being upfront with our constituents, talking about the science of this virus as we know it, the things that work to keep the virus under control. And unfortunately, what has happened is it's become political. Just to look at the couple of rallies that have taken place with the president in the past couple of days, rallies that are indoors where people are congregating close together, no facial protection or very minimal use of facial protection. And it just goes against the science and the grain of what we're trying to do as Americans and what we're trying to do as states. And so that's to me frustrating, and it's also regrettable. And as I mentioned earlier, our ability to get this pandemic under control, it's in our hands, and it's all about our behavior, and it's all about doing the right thing and following the science. And so when we have a president that ignores the science, number one, and then goes against what even his consultants are telling him to do, it's just defeating the purpose, and it's very frustrating. The other point I would make, Laura, and I certainly don't mean to be political, but I say this as a veteran, and I also say it as a doctor who took care of a lot of wounded soldiers during the Gulf War. And soldiers who a lot of have had traumatic brain injuries from explosive devices, A lot of them have had loss of limbs. A lot of them are suffering from post-traumatic stress disorder, and I consider them as heroes. I consider them the reason that I'm able to stand behind this microphone and as a Virginian and as American speak freely. And when we talk about the suicide rate of veterans, which is 17 per day in this country, when we have the leader of our country referring to people like me and other men and women who have worn the uniform and some who have ultimately paid the sacrifice of death, to refer to them as losers and suckers, it just turns my stomach. And so as an American, as a Virginian, I have trouble looking up to a leader. I have trouble respecting a leader that refers to my fellow veterans in that manner. And so, as I've said all along, and one of the reasons that I want to make this election as secure as we can to make sure that every vote counts, this is why we have elections. And I encourage everybody, not just in Virginia, but everybody in this country, to exercise their right on November the 3rd or prior to then and make sure that their vote counts.
Thank you. One question. Some people got to ask two. Governor, I'm sorry.
Thank you all very much.